It's time to have some adult conversations. Corrine Maury here. The time has come that we need to address the shortcomings of the harm reduction model and safe supply. We need to confront the social crisis that is stemming from drug use in our society, and if our attempts at preventing harm are actually working. In 2016, the BC public health officer, who at that time was Dr. Perry Kendall, declared a public health emergency because of the increase of drug-related overdose and deaths. As a result, the harm reduction model was introduced. This was an attempt to see if they could curb or stop what was becoming the leading cause of unnatural deaths in BC for adults. So there were two strategies that were implemented. One was to see if they could prevent overdose by increasing access to a drug called Narcan. And so when you use too much of an opioid, what happens is your brain tells your body to stop breathing. When you're given the Narcan, it reverses the effects of the opioid. And then the other thing was to provide sites where people could go and use their drugs under supervision so that you weren't alone in case something happened. The second strategy was to increase access to prescription drugs so that these prescribed narcotics could be more regulated in terms of what the dose was, and it would be provided by the government. So what this then became known as safe supply. So the concept was at least the amount that is being prescribed is regulated. We know how much the dose is in the pill, except the problem is once you give out a certain number of pills, medication, you actually can't control who gets it and how many people take. Because just because you have a low dose doesn't mean that it stops people from taking more. In 2023, drug possession was decriminalized. So this just made sure that drug users were not being criminally charged for having possession of drugs, because obviously that wasn't a successful strategy. So what were the results of these initiatives? Well, it took less than a year and BC had to introduce a ban on the use of drugs in public spaces due to public safety concerns. We also had stats showing that since 2016, when this model was introduced, we have had an increase of emergency services throughout the province. So BC Ambulance does stats on what calls are specifically related to opioid and drug overdose. And so they've been tracking these. So in 2016, there was about, looks like 19,000 calls. And by 2023, it had risen to 42,000 calls in BC. Now, why is this an issue? Well, because there's a lot of pressure on ambulance services in this province. There's a lot of work stress that is related to the kinds of calls, the number of calls, and the job demand, and we don't have a lot of paramedics. So this has put an increased stress on the system. We also have death rates from overdose have risen. In 2016, it was 996. And in 2023, those numbers had risen to 2,511. So we're talking more than tripled in less than 7 years. Drug diversion is a real problem. So what they are discovering, and Alberta just put in a complaint to BC because they were seeing an influx of drugs coming into the Alberta province. And it looks like they are traced back to prescriptions that are being given to users in BC, who then those users go and sell them on the street to be able to afford the harder drugs. So what we have now is we have an oversupply of narcotics in our system, which then leads to overuse. And then we have issues of toxicity and people dying, while at the same time we have not kept up with anything in terms of recovery, rehab, treatment centers. Most important was the BC Attorney General released a report in March of 2024 giving a review of the harm reduction model and how well did it fare. Now this is in a report called BC's Toxic Drug Crises Report. You can view it online. I'll give you a few excerpts. For those of you unfamiliar with the BC Attorney General's role, this is the position where you are the chief legal advisor to the BC government, and you, in this role, in this ministry, are responsible to administrate justice in the province. Interestingly, in the report, these are the following deficiencies that were noted in the harm reduction model.
In one of our audits, we looked at the implementation of overdose prevention and supervised consumption services. In the second, we looked at the implementation of the initial phase of the prescribed safer supply program. The ministries met some of the criteria we used to measure their performance. However, in both audits, we found significant deficiencies. Therefore, we concluded that the ministries had not ensured effective implementation of these life-saving programs that are such an integral part of the ministry's response to the toxic drug crisis. I want to say that I think it is unfortunate to see such shortcomings.
I will read it for you. Operational guidance lacked minimum service standards and did not always reflect engagement with health authorities and people with lived and living experience and Indigenous peoples. Here's the translation for you. The Attorney General's office determined that nothing was done. No one bothered to talk to the health authorities, who were the entities that oversaw the physicians, the prescribing of drugs, monitoring who was dispensing, and what the result was, because the government also didn't talk to those who used drugs either. Second thing, there were persistent challenges and barriers to province-wide implementation that were not addressed. Translation. We weren't actually able to get this project to work anywhere in BC over the last 7 years, but we did manage to spend $2.6 billion of your taxpayer dollars creating policies that killed more people than when we started. So what's the summary here? I mean, here we have one more example of this massive mismanagement of our government where there is no accountability. $2.6 billion has been wasted. Never mind the fact that all of this resource, which was supposed to be used to help and assist people, never got there. What are we going to do about this? Well, are we going to continue tolerating this kind of management of our province and of our resources? This is just one example I have of many. Our system is enabling addiction by providing a consistent and accessible source of drugs. We're responsible for this. So it's time we stop doing it. We also need to start focusing on the assistance that can come through counseling and rehab. And it's very apparent that our government is incapable of pulling that off. I don't see any other way except involving private industry or private groups or nonprofit groups to provide this service, because this is not happening through the public sector. I don't know how we got to this point where there is such a lack of competency in the provision of the services that we need. This is a pivotal point in our province. And all we have to do is drive through our communities to see the people that are impacted by this. And we're under the illusion that there is helpful strategies for them. We have to do better. So let's see if we can find a way to do this.